So what I'm going to do now is I'm going to go over the PGA Golf Tour exercises that were developed for Tiger Woods and for other golfers who have back problems. And these are very applicable to people who have chronic back pain, but also can be started with somebody in acute back pain. And these are band exercises. So this particular band can be put into a doorway and used that way, but since we have a ladder here, I'm going to just use it on the ladder. First exercise is what we call forward extension. I don't know if that's going to work. You might have to, is that going to be two? Okay, okay. So forward extension, or backward extension, I'm sorry. So this is going to be left extension. Can you still see me in there?
Yeah.
Okay. So left extension, I'm going to keep the pelvis exactly forward, and rotation only occurs at the trunk. So I'm going to push with my left shoulder backward, and then come back forward again. So I'm using my rotator muscles and my multifidi to move backwards, to push my back backwards. Then I will immediately go into forward flexion. So forward flexion means I'm going to use my right shoulder to flex forward and still keep the pelvis stable. So I'm going to go forward, about a 45-degree angle or whatever I can do. I'm going to come back again. And now I've done the forward extension, flexion on the right, extension on the left. Next, I will simply unravel, take my other hand, come backwards again, and now I'm going to go do right extension. So I'll start out straight ahead, and I'll extend as far as I can this way. Again, I try to move only from the trunk up. I try to keep my pelvis absolutely straight. And probably it's easier if I'm just straight out from the bar. So I come here. Okay, and that's right extension. Then I'm going to rotate one more, and I'm going to hold it like this. I'm going to do left flexion. So flexion is this way. And again, the pelvis doesn't move. I try to go to about a 45-degree angle using just rotation muscles and come back. Okay. Once I've done the number on each side, there's four different ones. There's forward flexion on the right, forward flexion on the left, backward extension on the left, backward extension on the right, and then I'm going to go to the pelvic level. I'll take this off and I'll attach it. Normally I could just put the handle in the doorway, but I'm going to attach it at about the waist height, so it's almost exactly waist height. And what I'll do again is I'll wrap it around and hold it at my waist, back up, okay? And it's just the opposite. This time the shoulders don't move and the pelvis rotates. So I go backwards. This is left extension. And once I've done the number I want to do that, probably about 20, I'll go into right flexion. So I'll come forward, hold my pelvis, my shoulders straight, and just use my pelvis to do right flexion. When I've done the right number of that, then I'll simply unwind, come around the other way, back up, and now I'll do right extension. So the shoulders stay forward, I turn only at the hips, and I extend back. And when I've done the number that I want to do that way, I will turn all the way around, walk forward again, and I'll do left flexion. So and this exercise uses all the intrinsic muscles along the spine. And again, this is one that can be done even when a patient is very, very acute, in the acute stages of disc injury, acute low back pain. They can carry this with them, they can do it in their hotel, they can do it at any time. Now, a more advanced exercise that you can add as the patient becomes better is what we call chops and pulls. So a chop is like this. We put the band up higher, and we come out. Sometimes we use two bands, or we can just use two bands together like this. And we bring the body out this way, we pull in like this and push down like that. That's called a chop, that's called a chop, like you're chopping wood. So come in and push down. In, push down. And again, you don't want to use too much of your, you're not using your whole body to do this. You're basically keeping the body solid and using more of an isometric force, and I can really feel that through my stomach and through my extensor muscles of my back. That's called a chop. And then a pull is going to be just the opposite. We're going to put it down very low and come out. And we're going to do just the opposite. We'll pull it up this way and then reach up like that. Up this way and reach up like that. In the beginning, one length is probably going to be enough. As the patient becomes stronger, if it's a very strong patient to start with, you can double it up. You can just pull it this way, come up, push up, come up, push up, come down. Okay? So that's the band exercises. You can turn it off.